Good afternoon, Elizo Monrio. I am Mihira. Let's begin the warm-up session. What do you find rewarding about being a nurse?
I truly love helping people, and the most rewarding thing for me as a nurse is seeing the joy of patients and their families. It is always a priceless feeling to see our patients recover to a normal life after going through a difficult time. Throughout my years as a nurse, I have seen many heartbreaking times as well, and being able to help those families cope with loss has been very difficult, but also rewarding.
How do you deal with someone who isn't satisfied with your patient care?
When faced with a dissatisfied patient, I assess the issue, determine if it's something within my control to correct, address their concerns, answer their questions, and collaborate with colleagues for alternative solutions if necessary. My goal is to accommodate the patient without compromising their care.
Tell me what you feel your greatest skill as a nurse is.
My greatest skill as a nurse is my communication ability. I'm very proud of my ability to listen to what a patient is telling me. Nothing frustrates them more than feeling as though they're not being heard, and actively listening can help make someone comfortable. In addition, I learned that addressing their concerns and communicating assuredly make them feel comfortable, which is important to receiving quality care.
Tell me what you feel your greatest skill as a nurse is.
My greatest skill as a nurse is my communication ability. I'm very proud of my ability to listen to what a patient is telling me. Nothing frustrates them more than feeling as though they're not being heard, and actively listening can help make someone comfortable. In addition, I learned that addressing their concerns and communicating assuredly make them feel comfortable, which is important to receiving quality care.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when I just can't do more. Seeing someone in pain or feeling miserable and knowing there's nothing you can do to help is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want to help, and when I can't, that's hard.
How do you handle the stress of the job?
To handle the stress of the job, I prioritize self-care and seek support from colleagues and loved ones. I maintain a healthy work-life balance by scheduling regular breaks, engaging in activities I enjoy outside of work, and practicing stress relief techniques such as mindfulness or exercise. Additionally, I make sure to communicate openly with my colleagues about any challenges I'm facing and seek their advice and support when needed. Taking time to decompress and recharge allows me to approach my work with renewed energy and focus, ultimately ensuring that I can continue to provide the best possible care to my patients.
Your preparation time is over. You can now start your OET speaking roleplay.
Mihira, I can see that you're understandably concerned about Emily's symptoms. It must have been alarming to see her struggling to breathe earlier. My name is Elizo Monrio, and I'm one of the nurses here. I'd like to assure you that we are here to provide Emily with the care she needs and to help ease any concerns you might have. Let's begin by discussing Emily's symptoms so we can understand the situation better and make sure she receives the appropriate treatment. Can you tell me a bit more about when her symptoms started and what exactly happened?
Thank you, Nurse Monrio. Well, Emily started having difficulty breathing about an hour ago. She had been running around in the garden, playing, and then suddenly started wheezing and saying she felt tight in her chest. It was really scary. Her symptoms seemed worse at first, but they've eased up a little now. I didn't give her any medicine because I wasn't sure what to give her. She's never had anything like this before.
Thank you for sharing those details, Mihira. It sounds like a very unsettling experience for both you and Emily. From what you've described, it seems the symptoms began after some physical activity, and it's good to hear they have lessened somewhat. Since this is her first episode, it's important we understand her overall health better. Can you tell me about Emily's general health so I can better understand her condition?
Emily is usually very healthy and she hasn't been sick lately. She's not taking any medications either. However, my husband had asthma as a child, but I don't think anyone else in the family has had asthma, hay fever, or eczema.
Thank you, Mihira, for that information. Emily's general good health is reassuring, and knowing your husband's history of asthma is helpful context. It's worth noting that asthma can sometimes run in families, but it's not always a definitive link. Based on what you've told me, Emily's condition appears stable at the moment. Her vital signs are normal, though there is a mild wheeze in her chest. I'd like to assure you that while this can be concerning, there is no immediate cause for alarm. Our next step will be to have Emily assessed by one of our doctors. They might perform some additional tests or investigations to better understand what's going on. While her symptoms are consistent with asthma, diagnosing asthma at Emily's age can be a bit tricky, as similar symptoms can sometimes stem from other causes. The doctor will determine if this is asthma or something else after a thorough examination.
I see. I really just want to know if she has asthma. It seems so likely because of her symptoms and my husband's history with it.
I completely understand your concern, Mihira, and it's natural to want answers as quickly as possible. While her symptoms do align with what we might see in asthma, it's not my role to make a diagnosis. Diagnosing asthma in young children can be complex, especially if this is the first episode. The doctor will consider her symptoms, and your family history, and possibly order some tests to arrive at a diagnosis. Rest assured, Emily is in good hands, and we're focused on getting her the right care. Do you have any other concerns or questions you'd like me to address while we wait for the doctor to see her?
I just hope we don't have to wait too long. It's so hard to see her like this, and I want her to get help quickly.
I completely understand how you're feeling, and I can assure you that we are not very busy right now. We have a good number of doctors on duty today, and I expect Emily will be seen quite soon. Mihira, the doctor's assessment will likely be quick and straightforward, and if needed, we can provide treatment such as a salbutamol inhaler to relieve her symptoms right away. For now, if you're comfortable, you can return to the waiting room, and we'll call you and Emily when it's her turn.
Thank you, Nurse Monrio. That sounds fine. I'll go back to the waiting room and wait for Emily to be called.
You're very welcome, Mihira. Thank you for your patience and understanding. Mihira, before you head back to the waiting room, let me quickly summarize everything we've discussed to ensure you feel clear and reassured about what's happening. Emily started having symptoms of chest tightness, wheezing, and difficulty breathing about an hour ago while playing in the garden. You mentioned that this is her first episode of such symptoms and that they seemed worse initially but have eased slightly now. You haven't given her any medication because you weren't sure what would be appropriate, which is perfectly understandable. You've also told me that Emily is generally a healthy child, hasn't been sick recently, and isn't on any medications. You mentioned a family history of asthma, as your husband experienced it as a child, though there isn't a history of hay fever or eczema in the family. From my examination, I can confirm that Emily's condition is currently stable, and her vital signs are normal, though there is a mild wheeze in her chest. This is something we'll monitor closely. As I mentioned earlier, while her symptoms are consistent with asthma, it's not something we can confirm right now. Diagnosing asthma in younger children can take time and may require more episodes or tests for a definitive answer. The doctor will make the final assessment. I understand you're concerned about how long you might have to wait to see the doctor. Let me reassure you that we're not very busy at the moment, and Emily is likely to be seen soon. The doctor's examination will be thorough but quick, and if needed, they can provide immediate relief, such as with a salbutamol inhaler. I hope this summary has clarified everything we've talked about. If you have any more questions or concerns while waiting, please don't hesitate to come back to me. We're here to support you and ensure Emily gets the care she needs.